During assembly, a technician notices a laparoscopic grasper with worn insulation. What should be done before it is sent for sterilization? A. Proceed with sterilization as long as it's functional. B. Send for immediate insulation testing and repair. C. Apply temporary protective wrap to cover the damaged area. D. Clean and use for low-risk cases only. Answer: B. Worn insulation poses a risk of electrical burns during surgery. Instruments must be tested, repaired, or replaced before sterilization to ensure patient safety and prevent electrosurgical hazards. Which method is most appropriate for sterilizing a rigid endoscope that is heat-sensitive but moisture-tolerant? A. Steam sterilization at 270 degrees Fahrenheit. B. Hydrogen peroxide gas plasma sterilization. C. Dry heat sterilization. D. High-level disinfection only. Answer: B. Hydrogen peroxide gas plasma provides effective sterilization at low temperatures, protecting delicate optics from heat damage while ensuring microbial kill. While unloading an autoclave, a technician notices condensation inside some wrapped trays. What is the best immediate action? A. Return trays to autoclave for a short dry cycle. B. Allow trays to air dry in the sterile storage area. C. Place trays back into use since they passed the cycle. D. Discard trays and reprocess. Answer: A. If condensation is found in autoclave trays, return them for a short dry cycle to ensure sterility. The most critical parameter for verifying ethylene oxide sterilization effectiveness is A. Exposure time. B. Gas concentration. C. Temperature. D. All parameters together. Answer: D. EO sterilization effectiveness depends on time, temperature, gas concentration, and relative humidity. All must be controlled for proper sterilization. A CSPD technician finds a surgical set labeled with an incorrect sterilization date. The set is still in storage. The correct action is to A. Cross out the date and write the correct one. B. Place a new label without reprocessing. C. Remove from storage and reprocess. D. Use it immediately to avoid waste. Answer: C. Incorrect labeling creates uncertainty about sterility. Items with questionable processing history must be reprocessed to ensure safety. In the decontamination area, the required airflow according to HSPA 9th edition standards is A. Positive air pressure with 15 air exchanges per hour. B. Negative air pressure with 10 air exchanges per hour. C. Positive air pressure with 12 air exchanges per hour. D. Negative air pressure with 6 air exchanges per hour. Answer: B. Decontamination areas require negative pressure to prevent contaminated air from escaping, with at least 10 air exchanges per hour for safety. Which indicator provides proof that sterilization conditions were met inside a package? A. External process indicator. B. Biological indicator. C. Internal chemical indicator. D. Load control record. Answer: C. Internal chemical indicators verify sterilization conditions inside a package and ensure that the sterilant reached all surfaces. While preparing a load for low-temperature sterilization, the technician notices residual moisture inside lumened instruments. The correct next step is to A. Blow air through lumens and proceed. B. Dry thoroughly before sterilization. C. Leave moisture to aid sterilant penetration. D. Flush with saline to prepare. Answer: B. Moisture can interfere with low-temperature sterilants like hydrogen peroxide gas plasma. Lumens must be completely dry before processing. Which step comes immediately after manual cleaning of instruments in the decontamination process? A. Assembly. B. Mechanical cleaning in an ultrasonic washer. C. Inspection for functionality. D. Packaging. Answer: B. After manual cleaning, instruments often undergo ultrasonic cleaning to remove microscopic debris from joints and crevices. What is the correct storage condition for sterile packaged surgical instruments? A. Humidity less than 70% and controlled temperature. B. Humidity between 75 to 90% with minimal airflow. C. Any room without direct sunlight exposure. D. Humidity over 80% for seal integrity. Answer: A. Proper sterile storage requires low humidity and controlled temperature to maintain sterility and packaging integrity. A wrapped instrument tray shows a chemical indicator change on the outside but not on the inside after sterilization. The technician should: A. Release the tray for use. B. Rerun only the internal indicator. C. Consider the tray non-sterile and reprocess. D. Wipe the tray with disinfectant and use. Answer: C. Failure of the internal indicator means sterilant did not fully penetrate the package. The item must be reprocessed. Which cleaning agent is best for removing organic material such as blood from instruments? A. Neutral pH enzymatic detergent. B. High acid cleaner. C. Abrasive powder cleanser. D. Alcohol-based wipe. Answer: A. Neutral pH enzymatic detergents break down organic debris like proteins without damaging instrument surfaces. What is the main advantage of using a biological indicator over a chemical indicator? A. It is less expensive. B. It detects the actual microbial kill. C. It changes color more quickly. D. It can be reused multiple times. Answer: B. Biological indicators contain highly resistant spores, providing direct evidence of sterilization effectiveness by confirming microbial kill. Which sterilization method is most suitable for liquids in sealed containers? A. Steam sterilization with gravity displacement. B. Dry heat sterilization. C. EO gas sterilization. D. Steam sterilization with a liquid cycle. Answer: D. The liquid cycle in steam sterilizers is designed to process sealed liquids without boiling or container breakage. In which stage of instrument reprocessing should hinged instruments be unlocked? A. Only during sterilization. B. During cleaning and sterilization. C. During cleaning only. D. During inspection only. Answer: B. Hinged instruments should be unlocked during both cleaning and sterilization to allow complete exposure to detergents and sterilant. A load in the sterilizer failed due to a wet steam condition. Which cause is most likely? A. Excessive drying time. B. Overloading the chamber. C. High steam quality. D. Using distilled water. Answer: B. Overloading restricts steam flow, causing condensation and wet packs that can compromise sterility. Which test is performed daily to ensure a pre-vacuum steam sterilizer's air removal system is working properly? A. Bowie-Dick test. B. Leak test. C. Biological indicator test. D. Chemical indicator test. Answer: A. The Bowie-Dick test confirms proper air removal and steam penetration in pre-vacuum sterilizers. During assembly, the technician notices a rust stain on an instrument. The best first step is to: A. Send for rust removal or replacement. B. Remove rust using an abrasive cleaner. C. Wash again with enzymatic detergent. D. Use the instrument since rust is harmless. Answer: A. Rust weakens instruments and can harbor bacteria. Affected items must be repaired or replaced. Which type of water is recommended for the final rinse of instruments to prevent mineral deposits? A. Tap water. B. Distilled or deionized water. C. Softened water only. D. Chlorinated water. Answer B. Distilled or deionized water prevents mineral buildup that could damage instruments or interfere with sterilization. In sterile storage, the event-related sterility concept means A. Items expire after a fixed number of days. B. Items remain sterile unless compromised. C. All items must be used within 1 year. D. Items remain sterile if unopened but handled daily. Answer B. Event-related sterility holds that sterility is maintained until a package is damaged or opened, not based on arbitrary dates.